Hello guys, so hope you're all okay, you're all enjoying your life and you're also enjoying watching my videos. I'm Dr. Arshad Nadeem Aman with ultrasound and radiology teaching videos. Before going to start my lecture and this video, I would say thanks to Stylo. This beautiful jumper has been gifted to me by Stylo. Stylo is a business organization. It's dealing with the beautiful clothes, with electronics, with jewelries. There is a link down below. You must go and look for the different items what they are offering, and it's really worth buying there. So now I will come to my own topic, and today I'm going to discuss about the hemangioma. Hemangioma is actually a congenital vascular malformation, and it is of two type, maybe capillary hemangioma, or it may be cavernous hemangioma. So far, its presentation on the X-rays are concerned, it causes expansion of the bone with extra osseous components. Clinically, sometimes it may be asymptomatic, but in terms of complication, if the vertebral bodies are involved, it causes neural deficit and some other abnormalities, even fracture and many more. Uh, if you look for the CT scan, on the CT images, it will appear a lytic lesion, especially, and there will be striation, and another particular sign which is called as Cartwright sign. You can appreciate the Cartwright sign especially when the vertebrae are involved. There is another sign which is called as polka dot sign. You can also appreciate this on the CT images as well. As far as the long bones are concerned, you will see that this hemangioma involved mostly epiphysis and metaphyseal lesion. In the small bone, or in the flat bone, it will appear as a lytic lesion with soap bubble appearance. If the skull is involved, on the skull there is a particular presentation which is called as honeycomb appearance, along with the sclerotic margin. So this is what all the appearances of the hemangioma is. It's a very important tumor, and you will come across in the bone and with the extra osseous component, and even as an extra osseous soft tissue tumor as well. How it will look on the imaging, how we will appreciate this on different modalities, how we will write the report. Let's start watching these images. Hemangioma and vascular malformations of the soft tissue sometime within the bone, and it is termed as a benign lesion closely resembling normal blood vessels. However, the hemangioma may be classified as depending on the prominent vessel types involved. The most common one is the soft tissue tumors, and most common tumor is usually seen in the infancy and in the childhood. Here, these above images shows the soft tissue hemangioma, and adjacent to it you can appreciate that how it will appear on the MRI, how it will appear clinically, and how it will appear on the X-ray images. The hemangioma radiograph, here on this image you can appreciate the hemangioma radiograph, which shows low density soft tissue mass surrounding the bones. This is the one characteristic, and the second one is calcification can be seen. Calcification is very common in the hemangioma. Soft tissue calcification would be visible, and changes involving underlying bone often evident. Sometimes you can also appreciate the underlying bone will also be affected by the hemangioma. Here in this case, this tibial region shows a surrounding lucency of the hemangioma, having multiple tiny calcific foci calcification. So this is a classical example of the hemangioma on the X-rays. Hemangioma can also occur within the bone, and especially the most common bone which is involved in hemangioma, the spine. Spine is the commonest site for the hemangioma, especially it can involve the lumbar vertebra, and it also involve the lower thoracic vertebra. On the spine, there is a characteristic appearance of the hemangioma which is called as Cartwright sign. So Cartwright, actually this is the pant we are regularly wearing, especially in winter season. It has a long striation in it, so it will resemble as a Cartwright sign within the vertebral body. So within the vertebra you can appreciate that this is the thoracolumbar spine, in which you can appreciate that this is a striation within it. This is intervertebral hemangioma, and it also has sometimes it extend to the extra osseous, and it involves the extra osseous component as well. Hemangioma can occur at any age of the life, and it involves mostly lumbar vertebra, it involves the soft tissue, and it also involves the skull. On the skull you can appreciate, especially in this view, you can appreciate that the radiating mature speculation, it producing a particular type of appearance which is called as sunburst appearance, and you can also see the expansions of the outer table as compared to inner table. So this is what on the skull hemangioma you can appreciate. So you should not confuse for any other abnormality. This is what the typical characteristics of the hemangioma is on the skull radiograph. Here is another example of the skull hemangioma. As I mentioned, that the outer table would be involved, and the appearance of the lytic lesion will be like a honeycombing. So comparatively the picture is given for the understanding. So the another third important point is that the margins would be sclerotic. The lucent lesion surrounding by sclerotic margins having a honeycomb appearance is a characteristic appearance of the hemangioma in the skull. And beside this you will also appreciate that the outer table is expanded because of the hemangioma. So here in this image you can appreciate a classical appearance, honeycomb appearance of the hemangioma involving the skull, and this is the characteristic example. Here another example for the understanding, you can appreciate a lucent lesion involving the parietal bone. Outer table is slightly enlarged, and this appearance shows honeycomb appearance. This lesion shows honeycomb appearance. So far the margins are concerned, sclerotic margins can also be seen very well. So this is what the characteristic appearance of the hemangioma involving the skull. So far you have seen hemangioma involving the soft tissue having phleboliths, hemangioma involving the intervertebral disc having a special sign, Cartwright sign, and if hemangioma involves the skull, so this will appear as a honeycomb appearance. Here this is another characteristic feature, and on the MR you can appreciate that this is the sign, this is the lesion which you can appreciate on the MRI scan. MRI is the best modality, and predominantly enhancement of the vessel can be seen. Sometime if there is hemorrhage, so hemorrhage may produce fluid level. So in the differentials of the fluid level on the MRI, you can include the hemangioma besides some other like giant cell tumor and the aneurysmal bone cyst. You can include the hemangioma. It will appear as a fluid level on the MR image.